Namaste and welcome to Dr. Fitness. Although Dr. Fitness is primarily a channel for fitness for middle-aged or older people mostly, today we start a series of videos that is really close to my heart. So this is in the field of geriatrics, specifically taking care of elderly people at home. So elderly care at home is a very important topic that we need to discuss and people need to know a little more about it. It's very physically and emotionally challenging to take care of elderly people at home, and there's a lot of juggling that's going on with people when they're trying to take care of people at home. So I thought this series of video might give a little bit of additional guidance and help and support for people when they're doing this. So today I have with me my dear friend and colleague Dr. Radhika. So Dr. Radhika is board certified in internal medicine. She practices in Manipal Hospital, Vattur here in Bangalore. She's not only taking care of several elderly people throughout her career and practice, but she has the personal experience and challenges of taking care of several elderly people at home as well. So I couldn't think of a better person to conduct this video with me other than Dr. Radhika. So Dr. Radhika, welcome to Dr. Fitness.
Thank you, Dr. Indira. You have been taking care of elderly patients throughout your career. What inspires you to do these videos?
Yes, so I have come across hundreds of elderly people that are being taken care of at home by their loved ones very beautifully, but I find that they find it very challenging because they don't have all the tools that they need. So I'm talking about this primarily in the Indian context, where we don't have a single home care agency for the most part that people can avail to, or they don't all come under one umbrella where patients and their families can go to when they have questions, or they just need some practical tips how to take care of people at home. So in India, most people end up seeing specialists. So the care can sometimes be quite a piecemeal approach, or sometimes they have various other providers who come home and they're all not interacting or talking to each other. So hence this becomes very important this tool becomes very important for them, just as another additional support or guidance how to do this at home in a more comfortable way. So I hope our viewers really enjoy this video.
Yes, these videos will be very informative for families who are taking care of dependent or partially dependent elders, and also for elderly who need extra support through support services or through various tips that you're going to help in these videos with.
Yes. So elderly people have a multitude of medical problems, right? They just don't have one single problem. So they tend to tip over the line and fall very easily. So sometimes it's just a minor illness or a minor surgery, and they take a really long time to recover. So these videos are made for a whole host of people. Some of them may just have a temporary illness, and they may just take a few weeks to recover, but sometimes this may be a more protracted course where they are not able to leave their homes or live independently for a longer period of time, and may be ultimately dependent on caregivers at home. Right. So these videos are meant for them. So I need our viewers to remember that our videos will not address any one specific condition, right? This is more of symptomatic treatment. This is very generic guideline. So I hope common sense prevails when people are watching this video, and this should not be a substitute for sound advice from your doctor or doctors and your other healthcare providers. But this is more as practical tips and tools. So please use this as just another support, but not as a substitute to your doctor's advice. So I really want to emphasize that.
Dr. Indira, as an experienced geriatrician, who are the various healthcare providers who can be involved in home care?
Yes, that's a very interesting question, because they are very important for patient care. Patient is in the center, and of course the doctor and the family members are at the center. Then there are all these other people that take care of them. So in my experience, the most common healthcare provider at home is an attendant. Most of the time it's an untrained attendant. I mean, they may just have, it's not a nurse. So it's just an attendant. Then of course, sometimes there's a certified nurse. There's a lot of times there's a physiotherapist who comes in for the patient. Then there's various diagnostic services available in India, but most of the time it's home lab collection that gets sent off to a nearby lab or a hospital. Then there's ambulance services. And perhaps a local pharmacy that delivers medicines. So these are the healthcare providers that are actually involved in taking care of a patient. Sometimes, very rarely, there is a doctor who can visit home. That comes in very, very handy. But most of the time it's a doctor who's generally sitting outside. But sometimes, yes, a home doctor visit is also part of home care.
This information is good for the family member who is usually the main caregiver to know that there are so many services available that they can utilize as and when is required when the elderly need it.
Yes.
But they are the main point of contact to integrate all these different services and deliver the care for the elderly with close guidance from their doctors.
Yes, and one must remember that the more services you add at home, it also adds to the expense and financial burden to the caregiver, right? So, but they certainly are very useful in helping take care of elderly at home. Sometimes all these services are not necessary, but sometimes they certainly are very, very helpful. So they need to use this information well, and the doctor needs to use all these other providers well to help improve the patient health. Right?
What are some common diagnoses or reasons why people would need home care?
I would say that since people come with elderly people have so many medical issues, the most common reason would probably be just general debility, like such as recovering from an illness, weight loss, weight gain, arthritis, neuropathy, or just all the chronic medical conditions making them very debilitated. Then we have medical reasons such as dementia. Dementia being one of the top neurological conditions why they need it. It can be either Alzheimer's, or it can be dementia due to strokes. It can be dementia due to Parkinson's disease. Then of course we have people with other neurological conditions. Then we have patients who've had stroke or multiple strokes, making them difficult to ambulate and have mobility issues and cognitive issues. Congestive heart failure, chronic lung disease requiring oxygen. Among orthopedic conditions, arthritis is definitely one of them, but that primarily by itself doesn't lead to a lot of debility. So one of the most important orthopedic reasons for needing home care is hip fractures. People do not realize that hip fracture is not just like any other fracture. Hip fracture generally leads to a lot of morbidity for the rest of the lives for the most part. And it can also, of course, lead to a lot of mortality in the first few months. But hip fracture is a major condition where people need home care. Then we also have people who fall frequently. Falls and chronic urinary incontinence, all these make people very not comfortable stepping out of the house. So when people have frequent falls, urinary incontinence, all these issues, they just don't want to get out of the house. They end up being at home and then just get weaker and weaker and weaker, right? Then one of the other reasons is very prolonged illness or hospitalization. It might be multiple trauma, it might be a prolonged hospital stay where they're on the ventilator, all these things, yeah. So these are primarily the reasons why people need home care. Of course, it could be anything else as well.
Right. For the frail elderly, even a simple infection can be a setback where they would need extra care until they recover completely.
Yes, absolutely.
Dr. Indira, this is a very apt introductory video for caregivers as well as for elderly patients.
Thank you.
What topics would you be addressing in the subsequent videos?
Yes, so elderly people are very different from their younger counterparts. And they have some very specific symptomatology that is very unique to elderly people, right? No matter what the illness is, some symptoms are almost like a common pathway, or they become very common problems when elderly people get debilitated. So some of the topics that we will address in the subsequent videos will be addressing nutrition in the elderly when they become debilitated, falls and their prevention, then bladder care and bowel care. We'll probably talk about dementia, delirium, and depression. We will tell you what delirium is in that video.
Another important topic is the use of assistive devices, when to use them, how to use them, and what you need.
We'll also talk about caregiver stress, because I think that's a very, very important topic, and not many people talk about it, and caregivers are often forgotten. So we will talk about caregiver stress. We will also talk about some important decisions that need to be made when you're taking care of elderly people at home. That is extremely important, and leads to a lot of mental agony when decisions are not made at the correct time. We will also probably discuss some financial aspects of taking care of people at home. Yeah, so I hope our viewers stay tuned in and watch us in the subsequent videos.
Dr. Indira, most of our patients, most of the elders as well as their family members would like to be taken care of at home rather than being institutionalized, and the family members also are not ready to put their elders in nursing homes at this point in India.
Yeah.
All the information you are giving will empower the family members as well as elders to better take care of them at home. Thank you.
Yes, I certainly hope so, and I hope that our viewers will find this extremely resourceful. Thank you, Dr. Radhika, for interacting with me today. It was a pleasure, and I really thank our viewers for watching our videos today. And if you do like our videos, please share it with your family and friends, and do hit the subscribe button and the bell button. That way you can be alerted to our new videos as well. Thank you.
Thank you.